All right, so welcome back everyone. Welcome to day 2 of the Drug Pricing Policy Summit. Bienvenue tout le monde à la deuxième journée de notre sommet sur la politique des prix des médicaments. J'espère que vous avez eu une bonne soirée. I hope you had a nice evening, that you're feeling rested and energized for the second day, which promises to be very interesting and engaging as well. I wanted to just cover a few logistical items and give you a really brief overview of some of the discussions, some of the themes rather, that emerged from yesterday's small group discussions amongst the patient and caregiver representatives. So yes, we did have a very big day yesterday with lots of great conversations, lots of fantastic presentations, some wonderful commentary and questions from our patient representatives and from everyone in the room as well. So thank you for your active participation. Just as a little reminder, something I didn't mention yesterday, but of course, we encourage you to look after yourselves. If you need to, we've scheduled some breaks and some meals and so on, but if you need to step out at some point, get some air, or just go and clear your minds, please feel free to do so. And remember to look after yourselves and to make sure that you're keeping energized. With regard to logistical matters, I think everyone pretty much was here yesterday, so I won't go into too many details. I did want to just mention again for the Wi-Fi, the optimal network to be using is JCC Open 14, and you don't need a password to access it. Also, if you're going to be tweeting or using other forms of social media, we encourage you to use the DPPS 2017 hashtag, which will be a great way for us to also monitor what's being communicated during the summit. And finally, also, there's going to be an informal meeting at lunch for anyone who might be interested in discussing and hearing about CAPCA. There's going to be a meeting, or we encourage people to come in to these 3 tables at the front, and there'll be a bit of an update and discussion provided around CAPCA. So if that's something that's of interest to you, you can join the group, come have lunch at these 3 tables at the front. So yesterday after, at the end of the summit, we basically got together the organizing committee and reviewed some of the themes that had been discussed in these small patient groups, and also prepared things for work planning, because at the end of the day today, the patients and caregivers and patient representatives will be staying for 2 hours to really workshop and develop our plan of action for the next year, and as we move forward after the summit, as we had done last year for those who were present. So as it stands, we do have 5 committees that were set up, and we got that wonderful presentation yesterday on updates on the work that the committees have been doing. We have some sign-up sheets right in the corner over there. It's hidden by the screen, but for anyone who's interested in signing up for these committees or finding out more, we welcome you to either put your name and your contact information on those sign-up sheets, or to fill in the commitment forms as well. In your folders you will have received, certainly the patient representatives will have received a commitment form. The idea is to really encourage you to share with us the ways that you would like to be involved in the work moving forward, indicate any perhaps tools or measures that you need to be able to do that. And of course, we'll be following up. We'll see this afternoon if we want to keep those 5 committees, but in the meantime, we have created those 5 sign-up sheets. And we also want the observers as well. If you're interested in any of these committees or the work that's being done by these committees, certainly put down your name and your contact information, and we'll be in touch. We'll see, of course, with the patient groups how we want to structure those committees. In some cases, we'll probably look to observers as well to participate in different ways in that work. So please, make sure that you let us know how you want to be involved moving forward. There's also going to be a meeting scheduled, I believe, in the new year for those who are interested in championing health outcomes measurements and the approach that we've been talking about since yesterday. So we'll create another sign-up sheet that isn't there yet, but that will be there. So if that's something that you'd be interested in hearing more about and perhaps attending that meeting, make sure you leave your contact information with us as well so that we can follow up with you. So I think that's it by way of logistical matters. I did want to just briefly review a few of the themes that we saw emerging from yesterday's discussions amongst the patient groups. We haven't had a chance, as mentioned, of course, the observers were also meeting yesterday while we were having our small breakout discussions. After our panel presentations today, we'll have a chance to hear about what was discussed in the observer sessions yesterday. Alex and Jerry, who were kindly facilitating those sessions, will be reporting back to us. So that'll be really interesting and will also feed into the work that we'll be doing in the afternoon with the patient and caregiver groups. So just a really brief overview of some of the themes that were emerging that we've kind of categorized into shorter and longer term actions. Some of them, of course, are ambitious and will require the participation of very diverse stakeholders. But certainly, one of the key issues that was identified was the need to streamline existing processes and agencies. We certainly understood that there's a lot of stakeholders who are involved in affecting what prices for medications and other technologies, and also access to them. So there's certainly a need to perhaps streamline and harmonize these different processes and the agencies that are involved in spearheading them. And we certainly saw some nice examples yesterday from the panelists of things that are happening right now to try to harmonize and for these different stakeholders to work together. But that was certainly one of the priorities that the patients identified in the discussions, as well as a need for additional transparency in these processes. So not only making sure that we're not duplicating efforts and perhaps reinventing the wheel, but streamlining these processes and making sure that they're transparent and that patients have an ability to participate in them and to also be aware of what's going on. Patients and, of course, the public. Overall, this was a theme that I think has emerged from the last summit with the work of the working groups as well over the last year. And certainly, yes, in yesterday's discussions, that there's a need for additional training and education around various aspects, including what are these different processes and agencies that are involved in drug pricing policy in Canada, but also related issues. For example, one element that was discussed, or an area for intervention that was raised on a few occasions yesterday, was the role that patients can have in collecting data and in setting up registries and in collecting data that can, of course, contribute to the gathering of real-world evidence, and also in terms of health outcomes measurements to help us define what those outcomes should be, and also how we measure whether or not they're being attained. So I think we've identified, a general ongoing need for education, and as well as particular areas that might be worthy of focusing on as we move forward. In the longer term, there seemed to be really an interest in this health outcomes measurements approach that was presented in the first panel yesterday, and that has been kind of consistent to the summit, and we'll be discussing it today as well. So there certainly seemed to be an interest on the part of the patients and caregivers for this approach, and looking at how we can continue thinking about it and moving it forward in the Canadian context. And of course, looking at the role of patients in these processes, notably with the setting up of registries and the collection of data that can be really fundamental to this process. So that's certainly something that we'll be discussing with the patients and caregiver groups this afternoon, and then hopefully thinking about how we can move that forward in the coming year and future years as well. And finally, the last point that really stood out throughout the entire day and in the discussions is really the importance of a patient-centered approach. So certainly patients are key in reporting outcomes and in setting outcomes as well, but that patients really need to be involved in all stages of the process, in the work of all the agencies as well, and also recognition that within patients there's a huge variety of experiences, so a really strong need to recognize social determinants of health, geography as well, so within a same province, and within different provinces, of course, there's different mechanisms at play and different questions that can affect access to treatment and other technologies. So a key theme, I guess, is the importance of recognizing the centrality and making sure that patients are involved in all processes and all aspects, but also recognizing that within patients of a same disease or disability groups and amongst the different disease and disability groups, there's a lot of diversity, a lot of variety, and that accordingly people need to be provided with the supports and the assistance that they require to be able to participate meaningfully. So that's a very brief overview of the themes that emerged yesterday. We'll be curious to hear also from the observers and see what I imagine will be some overlap. So as mentioned for today, we're going to be going through, we have some panels with some wonderful speakers. And then we'll wrap things up after the last panel of the day, after lunch, with the presentation from our observers, at which point we'll wrap up the summit for everyone, for the observers and the patient groups, but we'll ask the patient and caregiver groups to stay with us for an additional amount of time, where we're going to be workshopping and developing our work plan and revising our committees and organizing ourselves for next steps and moving forward over the next year.